Welcome to the Odd Moms on Call, the podcast where we get real.
Real moms, real talk, real impact.
Join our diverse panel of moms from across the U.S. and Canada as we unpack the messy realities of raising kids in today's world.
We're diving deep into how politics, policies, and culture shape our lives.
And most importantly, we talk to our kids about it all.
Get ready for honest, unfiltered, insightful, and sometimes odd revelations
as we make sense of the world,
one conversation at a time.
Hey, you're back with Odd Moms, episode 2. This is Chelsea. I'm back. I also host Quiet Connection Postpartum Mental Health.
I'm Britt. I host the Odd Mom Pod.
And I'm Midori, and my husband and I host the Simply Midori podcast.
And I'm on the Canadian Face This show, and I'm just hanging out on Odd Moms on Call right now.
And we're really happy to have you.
We're honored, Emma.
Thank you.
We are. We're all secretly wishing we could run away to Canada.
Yeah, from Oklahoma over here. I'm like, please save me.
There was like a joke going around that Trump was like, oh, we'll take this territory or whatever. And they're like, okay, we'll take Vermont. And I was like, yeah, please take us. Please, it doesn't need to be a joke. You can take us. We can just walk across the border. So it's okay. Anyway, today, we're going to talk about healthcare. We're going to talk about healthcare in the U.S. and healthcare in Canada. And it's also exciting because Britt works in healthcare. So, they have firsthand experience in there. And then Emma, I feel like I'm talking for everyone, but Emma's got all the deets on Canadian healthcare, and then we can all kind of talk about our experiences with healthcare. So, I don't know, where do you guys want to start?
Right, do you want to start with your experience on it, what you're dealing with right now? I'm also have a nursing background, and I burnt out in 2019, so I have a little bit insight that way too.
Yeah, so I have some different perspectives with the United States healthcare system because I am a nurse. I've been a nurse for 12 years now. I actively work in an emergency room here in one of the busiest emergency rooms in Oklahoma City. And I own my own private practice clinic doing infant feeding. So I'm internationally board certified in lactation and have been in practice now since 2022. And do that part-time as well. And as a special needs mom, 2 of my kiddos have a rare genetic metabolic disorder. My oldest has had over 30 hospitalizations, and she is 11. And as a lupus warrior myself, who was just diagnosed with lupus in 2019, I've kind of had unique experiences and touches on all sides of it, from private health insurance, having it, to my husband having to join the military so we could have health coverage because we were just sinking in medical debt so much so that we couldn't even afford to really survive. So he ended up having to join the military in 2018 just so that we could have healthcare coverage that would cover my daughter's metabolic condition stuff. And then later on, when I was diagnosed with my own stuff and now having to seek, again, private health insurance as I'm in the middle of a divorce and will be losing my TRICARE, the absolute horrifying idea of trying to find healthcare coverages. And if the current administration does scrap the Affordable Care Act, if now my pre-existing condition will inhibit me from being able to even get private health insurance coverage with affordable premiums and what that looks like. And so, it's been a very huge contributing factor in multiple areas of my life, and has honestly been the driving force of a lot of very huge decisions in my life, from who and how we get care. My oldest, we couldn't afford to get her the medication she needed, so she had to go on a clinical trial. We were traveling every month from New Mexico to Pittsburgh for her medical care. And so, it's been a huge, huge thing for me, and honestly has been one of the main things that I think has radicalized me when, people are like, oh, what radicalized you? And I think for me, being around and in the healthcare system, both as a provider and as a patient and as somebody who has had to amend the way I live my life so that I can get healthcare coverage, um, it has been one of the biggest things that has genuinely like liberalized me and made me such an advocate for Medicare for all and the importance of healthcare coverage and prevention care and those kinds of things, access to even abortion care when you have a genetic condition that you carry and your baby may have a condition that can genuinely impact their life or impede your ability to care for your living existing children because of those conditions. Like those are all things that become very real when now they enter your life and it's not just hypothetical anymore.
You literally like covered every single concern like that every American is facing right now. And it's all it's all on your shoulders. Like
Yeah.
right now.
It's absolutely crazy. And it's wild because I'm internationally board certified. I could get a work visa pretty much in any country in the world right now. Lactation consultants are on high demand, and the United States has the most out of any other country per capita as far as lactation consultants go. We have some of the lowest coverage rates for care, as far as that goes with insurance coverages and things like that. And so it's it's so wild that I could literally uproot my whole life and go somewhere to Canada or even been looking at like Uruguay and Paraguay because I've been down that rabbit hole of places I could move. Right now, I kid you not, but it's crazy. And so I'm really excited, honestly, to talk with Emma too, because grass is always greener sometimes when you're sitting here looking at like, oh, this care would be great, but I'm really excited to have a different perspective of somebody who does live in a place where coverage is taken care of, but what are the other cons or impacts to care?
Yeah, Emma, because you have like medically complex like stuff going on in your life too.
Yeah. So I have bipolar. So I see a psychiatrist every month or so. I see a psychologist every month. My kids are going through things. My son has asthma. He's only a year and a half. We've had 2 admissions and like countless ER visits. My oldest, we were going through the autism diagnosis process. She's actually a very social kid. So in North America, we don't have something called sensory processing disorder. That is typically, from what I believe, is in Europe and Australia. But in North America, that falls under the autism spectrum, but they don't get a diagnosis because they're social. So basically, we've come to the conclusion as of now, she has sensory processing challenges is what we go with. And so that has been a journey. We just realized she might actually have asthma because we're going through that. So we're doing a lot of things, and it's been really interesting to have these conversations because I just want to preface, for as much as that goes behind the scenes for free healthcare, like we do pay taxes, that's what funds it and all of these things. A lot of things aren't covered. We do have our own private insurance. That doesn't always cover it either. But at the end of the day, like I can say I'm so grateful to be in Canada because we don't have to go into debt in order to have our kids or ourselves be healthy and alive. And there's so much controversy about what goes on behind the scenes with the taxes. But at the end of the day, the average Canadian is not in debt to keep themselves alive. And I think that's just like, to me, that seems like the most basic fundamental thing to do for citizens of a country. And that's like what always gets me worked out about the American healthcare system because it blows me away.
I know I have a stat on this somewhere about the percentage of Americans. Okay, I think it was in 2023. The Kaiser Family Foundation reported that approximately 41% of adults in the U.S. Reported having medical debt due to unexpected medical bills or dental bills, or they were uninsured. So 41% of U.S. citizens were in medical debt just from unexpected costs or routine costs. I should specify.
Well,
So
what's crazy is because our routine care isn't covered, the unexpected things that do happen are so much worse. Like, so I work in the emergency department, you know, these I had a mind-blowing case of one of the sweetest, hardworking people I've ever met in my entire life last week, who we had these below freezing temperatures for 2 weeks straight. It was so horrible. And he was still getting up and walking a mile and a half to work every day, where he worked in a freezer truck helping to load groceries. And then we'll walk home, and he didn't have insurance, and his feet literally, his right foot literally started to fall off. It had become
no,
so frostbitten and horrific. And he said, I was just pouring bottles of alcohol on it, but once all the skin came off, I knew I needed to come in because he had no health insurance. He was just using Neosporin and bottles of rubbing alcohol to try and keep the infection from getting worse. And now he is in the hospital with a partial amputation and weeks of antibiotics and all of these things that now he, as an uninsured person, having his preventative care covered would have made it so that he wouldn't have had to have now this emergent care. When you're looking in the healthcare industry in the United States, it's like those are the things where like our lowered cost of preventative care for everybody would significantly and drastically reduce the overhead of the unexpected things that come up if those things were just covered for everyone.
I think going like from the Canadian perspective, it's interesting because I find Canadian healthcare great in emergencies, but the preventative care, I want to pull up a stat because one of the biggest things is a lot of Canadians right now can't find a family doctor. I don't think I have the stat on me, but there's a lack of family doctors. So we have people who will move 2 hours away and still travel back to get a family doctor because they just can't get access. There are a lot more urgent care clinics now that if you have a family doctor with a certain practice, they will penalize you to going to another doctor unless you go to their practice and see doctors in their practice. That's becoming more normalized. We do have walk-in clinics, which anyone can go to. And that kind of gives you access. The quality is hit or miss depending on the situation. But at least it's something. And I feel like that's so brutal to say in this environment, like, at least it's something, but it is. Like, when you look at that case that you just shared, like, in Canada, he could have gone to the walk-in clinic. Our ER times, I don't know what it's like there, but are notorious for 8 hours plus to be in the ER. A couple weeks ago, I had a horrific migraine. After a week, it just could not break. No pain medication was touching it. So I went to the ER. I was there for 9 hours from start to finish, but I got relief and I paid for parking. I think I paid $18 for parking. And a tea that they asked me because I was very cold and they were out of tea and they said I needed to warm up. So I walked to get myself a tea. So it's like, sure, I could say 9 hours is exhausting, but like I paid $18 for that. And like, I don't know how you argue
And as
that.
somebody who works in an emergency room, that is pretty on average, I would assume here for
So
something
yeah,
like that.
I
So many
wanted to
Canadians are
ask
like, the
you.
US is so much quicker. But
So that's the thing. That's
No.
the thing. So the stats that I'm getting, the stats that I got, I could not believe them. Like, this is what, and I did my research, but I honestly can't believe that this is true because this is not what I'm experiencing. But so it says, again, this is 2024. The average wait or time spent in an emergency department before leaving was approximately 2 hours and 42 minutes. The highest wait time is in DC, and that's about 5 hours and 15 minutes. And the lowest wait time is an hour and 50 minutes in North Dakota. But I was like, that is not what I'm hearing. That is not what I'm seeing. Like, I'm in Vermont, and again, It depends on what you go in with triage and whatever. But like, we have people saying like, don't even bother going in. You'll be there all day. I mean, I feel like I want to like Midori. What do you have you guys like? Do you have to use a hospital often?
Well,
Do you?
I feel like we probably don't use the doctor as much as like I'm not like anti anything, but but my experience with the emergency room, but we live like in the suburbs of Chicago now. Like when we lived in the city, I only saw an immediate patient get taken care of quickly in Chicago was when literally our friend's husband died and they like got rushed him in. And so obviously they're going to triage him first because he was like this close to death and then he died there minutes later. So that's the only time I've ever seen like a downtown emergency room move quickly. So we were in the city, we avoided the emergency room like at all costs. Like we just didn't, unless it was like, and you actually needed to go in because it just would take all day. And I will say like moving out to the suburbs of the city, like we're like half an hour outside of the city now. Like my daughter busted her head open on our fireplace and they saw her within it, like the ambulance was here and they got her over there like within like a 90-minute window, like picking her up, getting her in and getting seen was really fast. And then our neighbor like snapped his ankle, aggressively playing kickball with the children in the cul-de-sac. And I was also like, I was like, yeah, maybe it's because you're 40 or just should let the kids win for a moment, but it's fine. But like they saw him in the same amount of time, but we're also like in a, like we're not downtown. So like that's been our two experience, like personal experiences with the emergency rooms out here. But like I said, when we were in the city, like we definitely did not go. I just think that I agree that we could help the American people like be healthy before it gets super bad in any fashion, like that would help. Like the guy that you were explaining, Brett, that hurt his foot, not just hurt his foot, like I didn't mean to downplay that, but like had this foot situation. It's like if we could proactively get ahead of some of these things, whether it be with our food or like doctor's appointments, whatever like people need, it would avoid the long-term issues that we deal with, which costs the country the people, that whatever, so much money, right? Like we have my grandparents living here, like I told you guys before, and it's like they're 90 something years old. It just is like crazy. It's like a lot of these things, my grandma had rheumatoid arthritis, so she has an autoimmune disease and they're 90. So like the healthcare opportunities back in the day were much different. And watching how they cared for her at the end of her life, I was like, this is so crazy. Like, this is just wild. Like, we're spending so much. Like, we got a hospice kit to our house within like 30 minutes. And it was like, because she's on Medicare, because, it has like morphine, lizazepam. I don't know if I'm saying that properly.
Azepam.
Yeah. And I was like, how can she get this in 30 minutes? But like, when you actually need a preventative, like, we're so quick to like jump to like this. It just is. It was like, I was like, nothing in the medical world like operates this quickly, but because she's dying, she can get free. Like we still have it, like a freaking thing of morphine that other was it. Yep. Lizazepam.
Lorazepam.
And one other, like a tablet within minutes delivered at midnight. Like I was like, this is backwards. Like this is so backwards. Like she's been ill for a while and yet it's impossible to get her treatment to like help sustain her healthy parts. But when she's dying, we can get things like a hospital bed, all these things delivered literally within like less than 3 hours. It was insane.
I have two thoughts. Like I'm jumping right. It's like my initial thought is, or thing that I want to say is like preventative care does not generate money, and the healthcare system in the US, I don't know about Canada, but stand for Canada, it's all for profit. Like it's so healthcare and preventative care isn't going to make anybody any money. If you keep people sick, you're going to make more money. My other question when you're talking about hospice and whatnot is like, do you guys have insurance? Do you have good insurance?
Well, I like my grandparents are on like they're old. So
they got it through Medicare?
Yeah, like that. But
okay.
They don't have, I mean, my grandparents are like a unique situation. Like they were first generation, born and raised in Southern California, were put in the Japanese internment camps, got everything taken away, moved to Florida with my grandma and her, like, I think she had 8 or 10 children, then ended up in Chicago. So, like, basically started from scratch in Chicago with all of her children. I say all this to say, like, they obviously didn't grow up with good insurance, because I don't even know, like, what insurances were available 2 generations ago, or if it's the same it is now. Like, I literally I'm ill knowledge on that. But my grandpa worked like 2 or 3 jobs his whole, because he raised 4 kids, and he was able to, like, get a really low level job at the airline with American Airlines that he worked for second shift after his day job for like almost 30 years. So he had supplemental insurance from that. But that's because he like took this entry level position because he knew he had 4 children, and he's not educated because he didn't, it was either like education or like go to war. So he went to, all of his brothers and him went to fight in the war. So I say all to say they do have supplemental, but all of this stuff that my grandma got was from her government insurance.
Medicare.
It just is like, it's so much money. Like, I would like, it costs her nothing out of pocket, right? But I'm like, how much did like the company get paid to provide this? Like,
Yeah.
it was just wild. I don't know if I answered your question. So
No, it does. It does answer my question. They had, and I'm not as well versed with Medicare, and I'm learning more about Medicaid. And I'm curious about how much Britt knows about that, and that if that's even like what that would the equivalent of that would be in Canada. And then with them gutting Medicare and Medicaid, that's obviously not the solution either.
Yeah, just like so hyperbolic. Like, can we find a median? So like there's a win-win for everybody, not just like
I know Midori's always are. Can we find middle ground? Let's find some middle ground.
Well, I'm like totally fine for the hyperbolic spaces as long as like it's benefiting not just one group of people.
Yeah.
Like that's not helpful.
Yeah, and right now that's all it is. I mean, you're benefiting these billionaires and the oligarchs who are currently taking over the United States government and the healthcare industries that are funding these things. And it's just such a disgusting for-profit system currently. Medicaid's really hard here in Oklahoma because Oklahoma, when the Affordable Care Act kind of came out and states decided on federal funding based on if they wanted to adhere to certain parts of the Affordable Care Act, Oklahoma decided to not participate in a lot of the programs that other federally funded programs get. So our access to Medicaid and Medicare here in Oklahoma City or in Oklahoma in general, is even harder and worse than other states. As a provider, I am in network with Medicaid in Oklahoma, and for lactation visits, it's almost impossible to get one covered by your insurance. Usually you have to have a referral for your primary care doctor, and access here for Medicaid, like pediatricians and things like that, is really difficult to find. And then once you get your approval from them, I think a couple times I've gotten Medicaid paid out, it's been like $17 for my visit, which, like, for just like not reference knowledge, my like self-pay rate for a hour and a half consultation with me is $225. So like that's how much I'm getting paid out. And so um at that point, it's not even worth paying my billing team or whatnot. So I've been seeing like high needs Medicaid clients completely pro bono for years, because it would cost me more money to pay my billing team the time and money that I get paid out from the insurance. And so, like, for a very long while, I was the only in network lactation consultant for Medicaid in the entire state of Oklahoma. And it's crazy. And I'm still one of the only ones that's in network with TRICARE. So TRICARE is another thing where it's technically government paid as far as insurance, but like as far as like TRICARE, the rates change. Those are closer like think it's closer to like $90 is what I get paid out from those visits versus what I still make from other insurances. But then it's crazy because like large insurance companies like Aetna will pay out like almost $400 for one visit. And so then our providers get into these where certain providers will refuse to take certain insurances because it doesn't make them enough money. And then, but like as a business owner and as a healthcare provider and somebody who has a lot of medical debt and somebody who has a lot of student loans because of my education that allows me to provide for the people, which is why I'm a huge proponent too, where I think that student loans should be written. There should be no such thing as student loans.
There's another
Because,
episode.
yeah, exactly. Honestly, because,
Or remember of our education system, like our education
yeah.
system, not like how are people going to afford universities when like our kids go to school? Like it was a fortune for us to go to school. If it keeps like increasing at this rate, it's crazy.
I have between my medical degrees and my certifications and all of that, I almost have, I think it's like $80,000 in school loans from my nursing degrees. And I'm using those daily to provide care for people in my community at sometimes free rate. So why isn't taxpayer money going to pay for my education if I'm serving in my community? Those kinds of things. Um, but like then that's where you get this monopoly of like only certain providers will see certain insurances. And then like when we fostered and had kids in the foster care system that were on state insurance, like a wait to get them in with a counselor would be like 6 to 9 months. But under, my friend's Blue Cross Blue Shield, they could see a therapist in the next day, and my kid in foster care couldn't get care, but a kid with private insurance could. And that's where it's like, I'm interested to kind of hear Emma's take on this because I know with the basic and payer things that those are similar circumstances. But I also think it's important to note that that's already happening here in the United States. And a lot of people are against like Medicare for all because they're like, oh, then that's going to be happening for everyone. But in reality, that's already happening.
I have a lot to say on that. So the basic structure of how we work is emergency rooms, walk-ins, doctors covered by the taxes that we pay. So different provinces have different levels of taxes, but basically all of that, a portion goes into this free healthcare. Because of that, our referral times are insane. So for psychiatrists, let's say for mental health, it's over a year. Wait. When I was already in the system in a hospital and my psychiatrist moved, I was still a 9-month wait, even as a patient. So my medication ran out, but I'm one of the fortunate Canadians who had a family doctor that was an involved family doctor. Not every family doctor should be in the industry they're in. So she continued my medication for me, so I got in. But most people that I know at this point is over a year wait to see a psychiatrist. And I'm speaking mostly to Ontario. I know the rest of Canada has similar experiences. For specialists, depending on what it is, it can be 3 months or it can also be over a year. The autism side of things, like if we talk about that, once you get a diagnosis, it's a 3+ year wait often to get government funded support. A lot of the things that I'm seeing is these children are getting diagnosed around 6 years old once they're in the school system and not getting supports till they're 10 or 11. There's a lot of things like that, not just on the autism spectrum, but again, in emergencies, we're great. Preventative care, supportive care.
Question. Okay, so when you say government funded support, are you saying like they're not getting any therapies or they're not getting like a substantial income support? Just because from our understanding what that means.
So a lot of supports like occupational therapy, for instance, is not covered. Right now, we're like my family in particular, my daughter does occupational therapy. We're privileged enough to be able to pay for it. Our private health insurance that we pay for doesn't cover it. And she is not diagnosed with anything, so we're not eligible for government funding. So we have someone who needs it, but because of that, can't do it. A lot of Canadians will pay for some sort of private insurance. those kinds range so much on what they cover. So if you have like the basics, maybe it's $100 a month for one person. Speaking to us, we're a family of 4. And I got grandfathered from when I was young off of my mom's work insurance. And now we pay privately, and I've added my husband and my kids. We pay $680 a month for it. And that doesn't cover things like occupational therapy. So we have great dental every 8 months, which is not even considered that good in Canada. It's usually 6 months. We have 80% coverage of dental procedures. I can get new prescriptions every 2 years. And I can get orthotics every year, because that's a random one, but like orthotics every year. So that kind of stuff is like where that coverage goes. We don't even have that great of therapy coverage at that price. I think the average psychologist is around $220 for an hour. Mine covers, I think, $60 a session for 4 sessions in a year. And we're paying that premium. The only reason we have private insurance is because of the medication I'm on. I have 80% coverage through it. However, I max that plan out almost every year because there's a cap. So then at the end of the year, I'm paying full price for the medication. Because I have private insurance, I'm not eligible for anything government covered. For instance, when my daughter was born in 2021, there was a formula shortage. I know there was one in the US as well. She was on very specific formula for reflux and a dairy sensitivity. You could not get that formula without a prescription. I brought the prescription to the pharmacy. She almost didn't sell it to me because I had private insurance, and she was saying I wasn't eligible because I had private insurance. Long discussion with her, and I was like, I'm not going to not feed my baby. So that worked out. But there's a lot of borderline consequences to being able to afford private insurance. However, the average, let's say 40-year-old isn't going to be covered regardless. We have children, can't remember the age, but under a certain age, if you don't have private insurance, it just changed. You can get some dental care. You have prescriptions covered. And I think over the age of 65, it does the same thing. But again, if you pay for private insurance, you're not eligible. So yes, we can go to the doctor if we have one. Yes, we can go to the ER, but we're still paying taxes for that. We're still paying for medication. We're still paying for coverage for other things that don't really cover anything. So now it's just like, again, I'm coming from an extremely privileged place that I can still afford to do these things. But I have a friend of a friend whose daughter has significant challenges with her autism, and she waited 2 years for a diagnosis and just got in, and the mother has been unable to work because she can't go into specialized childcare, and finding rent, doing government funding, all these things, like it just doesn't make sense. And so that's why when people ask me, I say Canada is amazing in emergency, especially with kids, but like also adults. Like when my son was in respiratory distress, we went to the ER. We were in the back within 30 minutes, and then he was admitted that night. So that's really great. And again, I didn't go into debt. I spent X amount in parking and some food for myself when we were admitted.
Are those like, are hospital admissions or like things like if a child was diagnosed with cancer or something like that, how are those treated in like the Canadian healthcare system? Do those fall under like Medicare, or not your, but like your like systematic system, or would that only be eligible for private insurance?
So things like oncology coverage is considered universal healthcare. So people don't pay for that. Medications typically depend on what it is. So my Oma, like my grandma, my Oma, had cancer around the end of her life. And like the actual cancer treatment was covered. The hospital was covered. But I don't know enough outside of that on the medication. I believe she would need to have insurance, or she was over that age where it was covered. Admissions, like depending, so you can have a shared room that's covered. My insurance provides private coverage, private room. So when I had my babies, I could have a private postpartum room. However, my insurance didn't cover the full of it. But at the end of the day, I think I paid $50 to cover the difference, which is not terrible, right? Like,
oh my God.
at all.
That's not
that's
terrible.
crazy.
Do you know how much it costs to have a baby
I
in
have
the
seen in
US?
some of the mom groups, it makes me physically ill when I look at the cost to have babies. That's the
Yeah.
other thing. IVF, I had 2 IVF babies. Um, in Ontario, you wait a year or 2 to be able to be on the list, but then they will cover an IVF round. You pay for the medications out of pocket, but they will cover the round. IUIs, and I know like this is still healthcare, but like IUIs in Ontario covered every time. You can have unlimited IUI tries, but the medication you pay for, and then privacy and all that. So it's hard because I say we have an incredible system. We're never fully knee deep in debt. But when it comes to preventative care, like Midori is saying, and like these other things, there's either huge wait times or you're paying for it. And then you're paying for the insurance that isn't really covering it.
So my thing, I guess my question would be like, what are the large benefits of paying for a private insurance in a system like that? Because like here in the United States, you either pay for a private insurance or you don't have insurance coverage. And so like for us, it makes sense to pay, I think when I paid for insurance, thankfully now my kids are covered under their dad's TRICARE regardless. But like when I was before he joined the military, it was just me, him, and 2 kids, and I think we were paying like $700 or $800 a month out of my check for my private insurance before cover that. But then we would pay like a copay amount to go to the doctors, or a certain percent of our prescriptions are covered. But like if we went to the emergency room, we'd have to pay $500. And every day that we were admitted, it was a $300 copay. The end of the day, when you did the math, because we were utilizing our healthcare, it made sense to pay that. But what in like Canada does that like what is the like benefit of having like a private health insurance?
And I think that you kind of hit the nail on the head. There's a lot of Canadians who don't pay for private health insurance because if they go to the dentist, it's like $300 or $400. They might go once a year. The insurance in Canada is like insurance. So for us, it's worth it because God forbid something happened with the kids and they needed to be hospitalized and they needed all this. The stays are covered, the private rooms are covered, that like extra comfort is covered. For me, my medications not covered would be thousands of dollars, because the prices are just outrageous of medication and we can't shop around. Like the price is the price. The pharmacy has different dispensary fees, but like the price. So one of my medications, I think it's like $400 a month, but I have 80% coverage of that. So I do make the money back in it. Like for medication alone, it's worth it. And my husband and I have had this talk actually quite a bit because insurance raises the price every year of what we pay. So it's just steadily.
Yeah, I just picked up even my prescriptions. I picked them up today, double the cost what they were the last time I picked them up 3 months ago, and I was like, "What the hell?" But I mean, that makes sense when you think about it that way, because in the U.S., our Medicaid and Medicare covers prescriptions, and so like that's considered covered. So like in Canada, is there like a bracket of like income, or I guess like you said, age, where like then that stuff does become covered if you aren't on a private insurance?
Yes. So age for sure. I do believe there is an income bracket, but I can't 100% verify that. And so with that, you still don't get like ton of coverage. So medication is mostly free minus some that they deem not covered. I don't know what their criteria is for that. We have one thing like on private insurance, again, there is one puffer that my son needs to take twice a day, every day. And most insurances cover it. Mine doesn't. They just don't. When I had hyperemesis gravidarum with my second, and I couldn't eat and I couldn't function, they covered the medication and then they changed their mind. So the next time I had to pay full price, just changed their mind. They said, we're not covering it anymore. So there's things, but because I have private insurance, there's no freeness. However, I don't even think that medication is covered because it's not an everyday coverage. So if there's a mom without private insurance, she would have had to pay for it as well. So it's just like there's a lot of nuanced things. And so one of the big political things is our province just went conservative again. It's been conservative, I think, for 4 years, which is more inclined to like Republican beliefs. And our premier is what he's called, is like senator or premier, wants to privatize healthcare. And there's a big uproar of that. There's a lot of people who support him. And there's a lot of people who, of course, don't. And so after COVID, we had an epidemic in like nursing homes, like thousands of people in nursing homes died. Is horrific. And it was because our healthcare workers are so undervalued, so underpaid. Like we have nurses who try to go to the States because the pay difference, depending on where you are in the States, obviously is so different. I want to do a quick thing, but like when I started as an RPN, which is just under RN, so we have like support workers, personal support workers, practical nurses in Ontario, they're registered practical nurses, otherwise they're licensed practical nurses, and then we have our RNs. I was making, I'm going to just quickly do the convergence on here. I was making just under $12 an hour as a nurse when I first started. It just, it's insane. And so RNs are paid typically a lot better when they're in the hospitals. But I burnt out before COVID because at that price and the politics in nursing, which I'm sure, Brit, you know. And there's also a saying, I don't know if it's a saying in the US, but like there's a lot of sayings where nurses eat their young is the saying. And I was just in a lot of bad situations. And so my anxiety couldn't handle it. And I was fortunate enough, I ended up stepping back. We focused on having our family, but our healthcare is just like, it's crumbling because no one is taking care of. The nurses aren't, the support staff aren't taken care of. There's so much abuse from patients in the hospitals, especially. And people are just fed up. And we are now having government incentives to increase our education and go back to the workforce and go to retirement homes, but nothing's been changed. All the issues are still there. They're just trying to basically buy things. We had a thing a couple of years ago where all the other more male-dominant services are allowed to have increases, but our government decided that nurses were capped. They couldn't have more increases past X amount, just because. And so it was hard not to see that a predominantly what identifies as a female occupation was being penalized. And I don't think it ever really recovered. And it just, for as good as our healthcare system is, it's still so broken. But at the end of the day, I still prefer not to be in debt.
Yeah. So if like just, and I'm sorry that I'm asking all these questions.
No,
I just think it's interesting, and I think it's fascinating. And I think it's just really educational because, when you are like, oh, I'm so for this, it's good to see all of the actual sides. So like if somebody is like, say something like a car accident, something really tragic happens, somebody's admitted to the hospital for like long-term amounts of care. If they don't have private insurance, is that type stuff covered? And then if it's not, how is the not debt? Is it just like wiped clean, or what does that look like?
It's covered. Okay. It's covered.
That's awesome.
Then
you're like, but then also, okay, so the hospital stays covered, but then are you going to be able to get the occupational therapy that you need afterwards? So where you learn how to walk?
So it depends. And from my understanding, oftentimes in those kinds of situations, people get, what's it called? Assigned a social worker. And that social worker will work with government, provincial setups to get you in a plan. So basically, once you're in the hospital, and again, not speaking to every case, just from what I know, a lot of the times you will get a social worker that can put into government funded supports. So there are things like that, and that can fast track it compared to like your average person getting referred. That can fast track it.
But that still leaves such a significant amount of people who are not getting care. And that still doesn't alleviate the problem of your healthcare system, your health nurses not being paid. I will say that is one thing that like I'm so thankful for, that I'm a registered nurse, and I do have my bachelor's as well. So that kind of helps with pay a little bit too. But like as a nurse here, I can go and I can work part-time nights in the ER, and that takes care of the foundation for me to be able to support myself and my 4 kids as a single parent. And so I will say that is one thing, I guess, that is a huge pro of like a for, privatized insurance is that, there are some pros to that. However, I also work in a system where now we're seeing a lot of the financial benefits that we were seeing during COVID. And the nurses were finally in the hospitals were finally starting to pay back more money to those nurses. And so we were having higher bonuses. Because we were at higher risk of contracting these serious illnesses. But then, you're also working hard hours. And if you've never been masked up in full PPE, in a room with somebody who's on a vent with COVID for 12 hours, flipping them from their belly to, like, you don't know, like, we earn every dollar. And the fact that, like, nurses are only making $12 doing that in Canada blows my mind. And no wonder it's such an issue because now we're seeing all these staff, like the staff were like, now you did have all this finances of money that you have in the hospitals and the for-profit system has so much money that now we're capable of seeing how much our work is valuable. And now they're trying to roll back all these financial incentives and nurses are quitting left and right. And we're having high turnover. And it's crazy because they're taking, as somebody who's employed already, they're taking away our overtime bonuses that we used to be able to sign up for in periods when the emergency room is really busy. If they're understaffed or we have what's called holds, like our hospital is full, we have people staying in the emergency room for sometimes days at a time, they'll have extra nurses come in and they say, we'll pay you an additional blank numbers per hour or certain amount of money per shift to pick up and like take these extra patients. And they're rolling back how much money we're getting for those, even though our change of amount of work hasn't changed at all. And so it's starting this internal crumble of our healthcare system too, where now our nurses are starting to see how for profit the system is and not for actually caring for the people that are providing for the patients. And then the patients are the ones that are, feeling that with the longer wait times and all of this because you have people leaving the field at insane rates.
I want to, speaking as someone who is not in the healthcare field at all, speaking, and I guess, like, I don't want to say that I represent like an average American, but like, so we have private insurance and we also have Medicaid supplemental just because of my situation. But that exact example, like when you're saying if someone got in a car accident and like they had to have a significant stay. So before my youngest was born, my husband was in a catastrophic motorcycle accident. He was hit head on by an elderly underinsured driver. He hit that car, bounced off that car, hit the car behind it, and then rolled down the road. The doctors, I'm not going to get into the whole thing, but like, honestly, like, he should not have survived. And his doctors still to this day are like, I don't know how you are walking. He broke his spine. Like, he had to have spinal surgery. Both of his wrists were broken. One of his wrists was off. Like, the list goes on and on. He was a mess. So he was that situation, and our family was that situation. We were in the ER, and then we were admitted for just over 2 weeks. And insurance goes, and the insurance goes so much deeper than just medical insurance in the US. So then you have auto insurance on top of it. So because we're in this medical crisis, but because it was an auto accident, our auto insurance policies were also involved with our medical insurance. And because the driver of the vehicle was underinsured, what should have been a payout to us to cover our medical costs, we didn't get. And then we had to pay for a lawyer. We had to get a lawyer. And even the lawyer was like, there's nothing to squeeze out of this guy. He's 80 something, like, and we don't want to ruin his life too. So at the end of the day, there's so much to it. So yes, we had great private insurance. It was great. but the bills were still in the hundreds of thousands, and there was absolutely no way that we could pay that. And the auto insurance should have covered that, but because the driver was underinsured, it wasn't there. Our lawyer had to have us write letters and make videos begging Blue Cross Blue Shield to not take the tiny settlement that we got. And it was minuscule. Like, my husband is going to be he's gonna need services for the rest of his life. He's going to need surgeries again down the road. What we got it's not going to pay for it. It's never going to pay for it. So we're still screwed, but we would have been even more screwed just because they felt compelled by our letters and our videos. They said, okay, we won't take what the auto insurance was going to pay out. We won't take that. You guys can have that. So it's not, yes, the medical system's broken and the medical insurance system is broken. And I'm thankful for the insurance that we had. But even with one of the best insurance policies in the state, we still had a bill for hundreds of thousands of dollars. And we had to pay a lawyer to talk them down and then talk the insurance company into not taking our settlement from us. So, like, it's broken across the board. I wish, and my hope for the future for us on Odd Moms is that we can get some more connections. I have friends in Australia, and I have friends in the UK, and I have friends in Norway, and the healthcare system. I'd really like to hear about what the healthcare system looks like there as well, because it's not working. And preventative care is the model that we should be following.
Preventative care and mental health care.
Yes, it always comes back to mental health.
I think you can if there's a way to couple like support for both of those on like big picture for like everybody, regardless of like financial situation, like the richest and the poorest like could benefit from preventative and mental health care. But it's like the last thing, it's the lowest like money driver.
But they just want to keep us sick.
Yeah.
So
but I also would argue that it's the most helpful. Like, I feel like if we can address preventative care and mental health, like we would have a holistically much more healthier country.
Absolutely. And the joke in it wasn't really a joke because it was absolutely terrifying. When RFK was saying that he wanted to stop all SSRIs and mental health medications and basically put people with mental health conditions on cannabis farms and detox us from SSRIs. Like, initially, I mean, I have OCD and PTSD, so initially I went into a spiral, but that's me. I'm good at that. But my second thought was like, well, the drug companies are never going to let that happen.
Never.
Because it's all for profit, because they won't make any money that way. So, and
if you like trace back to like where the big money payers are going, it's back to the freaking politicians.
Yeah.
So they're only going to be cutting their own income.
Like, it's all like a cycle. Like, they put, whatever. Yeah, like they make prescriptions, like monopolize them, and then they let them make all these derivatives, let everyone make it. Just is like, it's such a cyclical scam. Like, insurance, it just feels like it's such a scam regardless. In my experience, like, we have really good insurance, and I'm like, this is wild. I could literally go get like a $20, $300 facial, but like other things aren't covered. Like, this is insane. Like, this is like not okay. Like, this shouldn't, like, I'm happy because it like benefits me, but this is not how the system should work. Like, it's crazy. I'm like, some people like it. Yeah, it's mind boggling.
We may have to do another. Yeah, I was gonna say we may have to do another episode about this at
and
some
if we
point.
need to like put a pin in this question, totally good.
Oh my God, no! Ask the question.
It could be like our what's it called?
Like a cliffhanger.
Yeah,
cliffhanger.
Thanks to my sign language.
So I wrote like on Threads. I was like, "This is what I've been doing with my son. I'm so grateful I paid for parking and food. You shouldn't have to go in debt to keep your children alive." And I don't know her background. I didn't go into it. But she basically let me know that Americans who did not apply for the special programs or funding were too lazy to get out of debt. And yeah,
Was it
right.
a
That was
Canadian
my face
person
too.
said that?
It was some.
Or you don't know? Well, because it was on Threads.
It was on Threads. So
What
I
other-
didn't even look at her profile. Like, I don't want to give these people time of day. And I was basically like, I've never heard of that. I'd be really surprised that people are too lazy to live in extreme amount of debt. And she never responded. But she was basically saying there are programs that all Americans can apply to get out of debt. And I was like, I don't know about this because I would
No.
be surprised that people are living with 6 and 7 figure debt when it could just go away. So, okay. So it's not really a thing. I see all of you
No,
shaking.
so
No, I
there
think
are
there are-
programs.
so
There are programs you can apply to, but they're insanely hard to get.
Yeah. So from like my kid's metabolic disorder, because it's like, so for kids that are listed as like disability, right? Like we applied for disability. My kid was in the hospital 13 times in her first year. She has a feeding tube. She had a central line for 3 years. Because she had a metabolic disorder, we did not count under the disabilities that would cause blindness, deafness, or mental
Like
impact.
incapacity.
It did not. So she was not going to be able to get any coverage for Medicare, and was not able to get disability payments because it wasn't the right type. However, if she would have been diagnosed with cancer, or if she had been blind, or she had some other things, there are programs that will waive the like income requirements for certain diagnoses where they can then get coverage that they normally wouldn't. So like my friend's daughter, her daughter Emily had cancer, and everything, they had private insurance, but everything that private insurance didn't cover, they got a special type of Medicaid that covered anything remainder because of the grant and because of the diagnosis. So there are certain diagnoses that qualify, but not all of them.
Not for the average person. Like, you're not just going, hey, I would prefer debt instead of,
No.
Yeah.
being able to afford to
Yeah.
live.
All right,
Okay.
listen on.
We
No, it's
appealed
insane,
and
but I
applied.
needed to.
Yeah, and we appealed and applied, and you can get like a disability lawyer and you can fight for it, but you have to be able to afford those things first before you can even apply or be able to appeal them.
All right, Odd Moms, this is another one of those instances where we have to get back to our regular lives. But listeners, we want to hear from you. We want to hear about your experiences in the healthcare system, wherever you are. You'll hear it at the end, but email us, get on our website, get on Threads, get on Instagram, oddmomsoncall@gmail.com. We want to hear your stories. So this is definitely going to become a conversation that we get into again. But for now, we've got to go back to real life.
You've been on the line with Odd Moms on Call.
Because parenting doesn't come with a manual, but at least we've got each other.
If you've loved this episode, don't forget to subscribe.
Leave us a review and share it with your fellow moms or anyone else who could use a little chaos with their coffee.
Got a hot take you'd like to share?
Send us a message or shoot us an email at oddmomsoncall@gmail.com.
We might just talk about it on the show.